Cultural conversations often treat deep sadness as a passing mood, a funk to snap out of with positive thinking or a perspective change. MDD is a diagnosable medical reality affecting 21 million U.S. adults annually. It is defined by specific clinical criteria that distinguish it from the common human experience of sadness. Approximately 21% of the population will meet the criteria for MDD at some point in their lives. Looking at the scale, the data shows that women experience the condition at roughly twice the rate of men. The condition results in $44 billion in annual losses to the U.S. economy, driven by workplace absenteeism and presenteeism, where employees are physically present but unable to function. For a condition to cause this level of systemic economic and social disruption, the underlying cause must go deeper than a fleeting emotion. The clinical boundary for MDD is built on measurable, persistent dysfunction. Diagnosing MDD is a process of verifying that a patient has met a specific threshold of both duration and symptom severity. The baseline requires a persistent low mood, or anhedonia, the total loss of interest and pleasure. This state must remain constant for at least 14 days. Beyond the emotional state, clinicians track physiological markers, including significant disruptions in sleep, either insomnia or hypersomnia, and noticeable changes in appetite or weight. As the condition progresses, functioning capacity often drops into a critical failure zone. This manifests as severe fatigue, an inability to concentrate, and psychomotor agitation, or a physical slowing of movement. The clinical profile also includes internal cognitive extremes, pervasive feelings of worthlessness, excessive guilt, and recurrent thoughts of death or suicidal ideation. For a formal diagnosis, these symptoms must result in significant, measurable impairment in the patient's social, occupational, or other important areas of daily life. This evidence characterizes MDD as a pervasive biological and psychological syndrome that requires systemic clinical intervention. A licensed clinician performs a differential diagnosis to identify medical mimics, physical conditions that present with symptoms identical to MDD. Endocrine issues like hypothyroidism and nutritional deficiencies, specifically B12, can produce the same lethargy and low mood as clinical depression. The clinical interview also screens for underlying physical issues, like sleep apnea or the unmapped side effects of other medications. One of the most vital steps in this process is distinguishing MDD from bipolar disorder. This distinction is critical because treating unrecognized bipolar disorder with antidepressant monotherapy can trigger a dangerous manic episode, as shown by this volatile spike in the recovery curve. Because of these medical risks, a professional clinical interview is the only safe way to verify the condition and protect the patient's long-term brain health. Decades of clinical research have produced evidence-based treatments that show high efficacy in managing MDD symptoms. Clinicians utilize targeted therapeutic modalities, including cognitive behavioral therapy, behavioral activation, and interpersonal therapy, to address the psychological drivers of the disorder. In many cases, pharmacological interventions like SSRIs and SNRIs are used when a licensed clinician determines they are medically indicated to address biological imbalances. For moderate to severe MDD, the data is clear. Combining therapy and medication consistently outperforms either modality used alone. While MDD is a complex condition, it is highly treatable when navigated by professionals who can manage the nuances of the treatment matrix. For those in Georgia living with these symptoms, you do not have to navigate the complexities of diagnosis and treatment alone. Coping and healing counseling provides the clinical bridge between evidence-based science and your daily life. Their team includes over 15 licensed, culturally competent therapists, including LCSWs, LPCs, and LMFTs, serving residents in all 159 Georgia counties. To remove the common barriers to care, they offer 100% HIPAA-compliant telehealth and are in-network with major providers like Aetna, BCBS, UHC, Cigna, and Humana. They also prioritize accessibility by accepting Medicaid, which includes a $0 copay for eligible patients. Visit chctherapy.com or call 404-832-0102 to connect with the Georgia team. Because MDD is a clinical condition, healing requires more than time. It requires professional expertise.